Good afternoon, and thank you for joining us today. There is no better way than to honor Black History Month and to show the love for our community than to contribute to the safety of that community by getting vaccinated and boosted against COVID-19. Now, although we appear to be coming down on the current COVID-19 surge due to the very contagious Omicron variant, it is still very important for us to be vaccinated, as the vaccine remains the best protection against the virus. Today we have joining us Dr. K, who is an infectious disease specialist at MLK Community Healthcare. Dr. K has been serving on the front lines of the pandemic from the very beginning. Thank you, Dr. K, for being with us, and thank you for caring for the South LA community throughout this ongoing healthcare crisis.
Thank you for having me. It's my pleasure to be here. Everybody does call me Dr. K because it's easier. My name is Maita Kuvhenguhwa, and I have been with MLK Community Healthcare since 2018.
Awesome. So my name is Mariah Walton. I did not introduce myself, but I am the community relations specialist here at LA Care Health Plan. And so we're going to get into some questions with Dr. K and really provide some educational information for you all to feel confident about where we are at the current state of our health right now. So Dr. K, can you describe for us what the current situation is?
Yeah, so thankfully we do appear to be on the other side of this surge, meaning that cases are finally coming down and hospitalizations are finally coming down. But one truth really remains. The people who are getting the sickest from COVID-19 are still the unvaccinated. For example, unvaccinated people are 12 times more likely to suffer from COVID-19 fatality than people who are vaccinated. And although vaccines have vastly improved the chances that you will get severely sick from COVID, you still have to be vigilant and not let your guard down.
Absolutely. And how does the current surge directly affect the Black community of South LA?
So, unfortunately, we still have a significant percentage of unvaccinated community members in South LA. Vaccination really remains the best protection against the virus. The other worrisome factor is that many people in South LA already have underlying health conditions that put them at risk for severe COVID-19 disease. I'll give you some examples. Diabetes. The prevalence here is 3 times higher than in the rest of the state. There's also heart disease, kidney disease, high blood pressure, cancer. There's lots of different chronic illnesses. Other things may include COPD or asthma. As we've learned before, COVID-19 can be way more severe in people who have underlying health conditions.
Yeah. And what should people be doing right now?
So, if you're eligible, the best thing that you can do is to receive a full series of COVID-19 vaccines plus a booster vaccine. The CDC is referring to this as being up to date if you've had your full 2-dose series plus your booster. Also, everyone should return back to the COVID-19 fundamentals, practice social distancing, wearing masks when not around people from your household. In LA County, there are various mask orders for indoor versus outdoor, but if it's a crowded location, you can't go wrong wearing a mask. Wash your hands often. And then finally, stay home and away from other people if you feel sick.
Absolutely. And, one of the most disheartening things for me personally is just knowing how unvaccinated, how the percentage, if you will, that is significant between the Black and African American community. And so, can you talk a little bit more about what do you think the current concerns are and what might be influencing, that population when it comes to vaccine hesitancy, and how can we address some of those concerns?
So I spend a lot of time talking to patients about the COVID-19 vaccine and their health in general, whether it's in the hospital, when people are sick with COVID, or in the clinic. One of the main concerns that we continue to hear is that these vaccines are too new, or how do we know that it's safe if it was developed so fast? Just so you know, COVID-19 is part of a family of coronaviruses that scientists have been studying for over 20 years. This wealth of research actually helped speed the development of these vaccines. They're safe and they're effective against COVID-19. This vaccine has been years in the making. Let's go ahead and bust some other myths that are circulating out there as well. So the vaccine does not contain live virus, and it does not change your DNA. The bottom line is the vaccine is safe, effective, and the best way to protect all of us, meaning yourself, your family, and our community.
Yeah, I also, had some hesitancy, in the beginning of this thing and just had some of the same concerns about it being new. But I love that you talk about the fact that they have been researching this for years. And so we're in a better position now to really attack this thing as we are all enduring it together. Now, what are some of the latest news surrounding mask mandates? I know you kind of alluded to it earlier, but what are you hearing now, and how should people proceed as those mask mandates are changing?
So I think we're due to get some news today surrounding, I believe, outdoor mask mandates, which may be lifted, and then the indoor mandate may still stay in place. The best place to actually find out information about this is going to be your local health department. So for us in LA County, that's going to be the LA County Department of Public Health. That's always going to be your best resource. And it's also a personal choice issue. If you go somewhere and masks are not mandated, you can still feel free to mask to protect yourself.
Yeah, yeah. I know I will be. I do
Me too.
not want to experience I don't want to experience COVID-19 at all. And so I know with that surge of the Omicron variant, a lot of people were really under weather, and I never want to experience that. So I'll be masking up for the duration of this thing. Can we talk about a little bit more about the booster vaccine? When are people actually eligible to get the booster?
That's a great question. So the FDA actually reduced the amount of time between your Pfizer or Moderna vaccine and the booster. So it used to be that you had to wait 6 months to get your booster, and now you only have to wait 5. So that means if you received your last COVID-19 vaccine anytime before September of 2021, you're now eligible for a booster. The FDA also authorized Pfizer boosters for children 12 years and older and for children 5 to 11 who are immunocompromised. This means that they have a weakened immune system due to certain conditions or treatments.
And are kids able to or eligible to get the vaccine yet?
Yes, so COVID-19 vaccines are available for children ages 5 and up. Really rigorous research has demonstrated that this vaccine is safe for children and is the best way to prevent them from getting infected with COVID-19. The US does plan to roll out a vaccine for children under the age of 5 after it approves FDA authorization, and the meetings for this are still pending further data. I was on a call yesterday actually where they reported that they wanted more data for the third vaccine in these younger kids before making a decision. So it's forthcoming.
Yes, and we'll be on the lookout for it and sharing information so that our community members that are 5 and below can get the vaccine as well. Now, where can community members go to get COVID-19 vaccine as well as booster? Does the MLK Community Healthcare provide that service to the community?
Yes, we do. We have 3 South LA locations that offer the vaccine Monday through Friday. You can visit mlkch.org/COVID-19 for our hours and locations.
Awesome, awesome. And then can you talk a little bit more about the current state of hospitals? How can we, the community, as well as, just individuals that are around, help our frontline workers and support our local hospitals?
So while the number of COVID-19 cases is coming down and the number of hospitalizations is slowly coming down, there actually are things that community members can do. There are actually 3 things that you can do right now. Number 1, ensure that you, your loved ones, and your friends are vaccinated against COVID-19, which will reduce your chances of ending up in the hospital with COVID. You can also donate blood to your local blood bank, like the Red Cross. In fact, LA Care is hosting a blood drive on March 22nd from 9:30 a.m. to 3:30 p.m. in Los Angeles. You can visit facebook.com/LA Care Health for more details. And number 3, hospitals nationwide are busy. So if you're experiencing a non-life-threatening symptom, please try reaching out to your primary care doctor or call your health plan's nurse advice line. Another option would be to schedule a telehealth appointment, and this service is offered by most healthcare plans. You can call your healthcare provider for more information.
That's right. LA Care members have access to telehealth appointments through TeleDoc. And if you need more information on that, you can visit lacare.org teledoc, or you can call 1-800-TELEDOC, which is 1-800-835-2362. Now, we'd like to open it up for some questions from our audience. If you have a question, please ask now, and we will try our best to answer as many as we're able to. Alrighty, so our first question is Ari from Facebook. She asks, will another booster dose be needed soon? It's a great question.
It is. So currently, no, we have not gotten that recommendation yet from the CDC. Research is always ongoing, and this may end up being something similar to what we do with flu, where you have to get an annual vaccine. It remains to be seen. But at the moment, CDC has not released any information saying that a fourth dose will be required for the general population.
That's great information. It's a great question to ask, because I think that's something that's on people's mind to understand really what the future of the vaccine will look like. But I think it's still so early on that it's really hard to determine how we would move forward for the future, make sure that we're safe and protected against the virus. So the next question, I think they're coming in, so we're just waiting for another one here. Alrighty. This one's from Brighton from Facebook. Brighton asks, should I start vaccinations for children under 5 or wait till FDA and CDC approve the third shots?
So we always recommend going by what is authorized by FDA and CDC. It is forthcoming. And, the only reason why they waited was just to have more data on the booster shot for the younger children. So it is forthcoming, and the recommendation from my side is to wait for FDA and CDC to put out their official recommendation. One thing to consider might be that the dose for these children might be different than the either adult or older kid vaccines that you have on hand. So we are anxiously awaiting vaccines for the younger children.
For sure. Awesome. Thank you for that. Next question. Again, if you have questions, please feel free to write those in the comments. Our team is pulling those in order for us to address them here, while we have Dr. K in our presence to provide us with some medical understanding of the current health concern. So if you have questions, please feel free to drop them in the little chat on the platform that you are watching us on. Okay. We've got another one here. Okay. YT asks, do I have to use N95 mask still? That's one question. And then they ask, do hospitals provide them?
Ooh, that's a good question. Okay. So basically the recommendation coming from CDC is now cloth masks are not going to be the most protective. So in order of least protective to most protective, you have cloth masks, then you have surgical masks or medical grade masks that are not N95 respirators. Then you can get masks like a KN95 or a KF94, and then finally an N95 mask. So interestingly, there are some pharmacies like at CVS, they've been giving them away with purchases. And so that would be a good place to start looking. The masks that they're getting are authentic and provided by the government. So that's one place to look for authentic masks. And if you can't get N95, you can look for KF94. You can look for K95 masks as well.
Oh, that's great information. Thanks for asking that question, YT. I mean, I learned something in that, so it's good to know that we can get access to masks at some of our retailers, local retailers. So the next question that we have is, what factors should people take into account when deciding when to wear a mask and not to wear one?
Well, this is a great question as well. So my go-to is always, if it is a crowded location, if I'm standing within 6 feet of people, and also the airflow. So if there's poor ventilation in the space that you're in, you're going to want a mask. So when you're outside and it's spaced out and there's barely any people around, there's no one within 6 feet, then, if the local mask order for outdoors has expired in your area, you can feel pretty comfortable not masking. But if you're in an area that's crowded or poor ventilation, you're definitely going to want to mask. And then another place where I would say to mask is public transportation as well.
Mm, that's a good one. That's a good one. And a good reminder too, because I know so many people in LA take public transportation, back and forth to work. And, that's just really good to really understand, how we should be masking up, especially in spaces like that are shared. The next question we have comes from Nicole on LinkedIn. The question is, does a vaccine need a booster to be effective? And why isn't 2 vaccines enough?
Yeah, this is a good question too. So really, the boosters came out of the need to. So literally, the word boost means that your immunity from the first 2 shots starts to wane or decrease over time. This happens with every vaccine. That is the reason why we get a yearly flu vaccine. Part of the reason. The other part of the reason is that new strains come up and they need to kind of remix the formula. So really, the reason why there's a booster is because when they did the studies, they saw the highest level of immunity when people got that extra boost. So while 2 vaccines is more protective than no vaccine, really the booster is going to be your best chance at having that high level of immunity once your previous immunity from the 2 shots starts to wane.
Awesome. Awesome. I love that. And so, looks like that's all of the questions that we have today. I want to thank you all for joining this live session. And we really hope that you've learned something today to help educate your family members as well as friends on the importance of getting vaccinated and boosted against COVID-19. Let's honor and ensure that the safety of our community as best as possible by getting fully vaccinated and boosted as early as we can, especially based on our eligibility. And so we do want to make note that this session will be posted on our Facebook page for sharing. And we again thank you for joining us. Have a great day.